Well, head and neck cancer is almost unique in the fact that it's very visible cancer.
So it may change the voice, it may change their ability to eat and drink, it may change their vision, it may change their senses, their taste, their smell.
The tongue, the mouth, the throat, the voice box, the thyroid, the lymph glands in the neck.
We will often operate on patients and that can be disfiguring.
You can't hide anything. If you've had half your tongue removed and reconstructed,
one of the jobs that the Oracle Cancer Trust is doing is raising awareness that this disease exists, that it's becoming more common. In the last decade, we've seen a huge increase in head and neck cancer diagnoses.
It's 4 times more common than testicular cancer. It's affecting a much younger age group, people in their 30s and 40s and even younger than that. But only about 1% of research money in the UK goes to head and neck cancer.
Oracle is a charity committed to trying to improve the treatment for patients who have head and neck cancer. We fund pilot projects to develop new treatment techniques, and we aim to get those into a situation where we can test them into larger trials, which often get picked up by the larger funding bodies such as Cancer Research UK.
We've raised over £4 million in the last 10 years, and we've had a number of important advances.
We started working on trying to reduce the main side effect of radiotherapy, which is long-term severe dry mouth. It affects about 90% of patients with standard radiotherapy, could be reduced to about 20 to 25% with the new radiotherapy technique. And as a consequence of the trial, this new treatment has become the global standard of care for patients with head and neck cancer.
If it hadn't been for Oracle, then we wouldn't have been able to do it.
So one of the areas that we've been working on has been to develop a range of new drugs that will specifically make cancer cells sensitive to radiation, but they won't have the same effect in normal tissues. Drugs have already entered clinical trials in patients at the Royal Marsden Hospital and indeed elsewhere in the world.
Nigella Lawson became involved because her first husband, John Diamond, sadly developed throat cancer. She raised a lot of money for us. With that money, I started the John Diamond Voice Laboratory. We can analyse the voice and analyse the techniques that we're using for radiotherapy and surgery to try to get optimal functional results with treatment.
Well, the role of Oracle in terms of funding pilot projects is absolutely critical to the success of our head and neck research programme.
To run a project for a year, it's about £50,000. We need every penny that we can get as quickly as possible in order to understand this disease and design new ways to combat it and to cure more patients.
One of the other things that Oracle is trying to do is to raise awareness about the early symptoms of head and neck cancer. A sore throat that persists for more than 2 or 3 weeks, a little ulcer in the mouth that doesn't heal up, or a lump in the neck that persists for more than 3 or 4 weeks. Seek advice early because that makes a lot of difference to the chances of survival.
We are often the first port of call to be able to diagnose and find early stages of oral cancer. A full extraoral exam involves looking at all the muscles of the neck, the glands, even the back of the head and the jaw joint, and then we have a thorough look inside the mouth. One checkup, one full assessment can make a difference and save a life.
Why am I so passionate about Oracle? The reason is simply because of my patients. I feel a great sense of pride and pleasure when we can cure someone. We're desperate to not only improve our cure rates for head and neck cancer, but also quality of life.